So today's video is for every girl, every woman, and I think every parent who has some confusion around periods. Periods is one of the most common biological processes, but yet there are so many confusions, so much embarrassment, and so many myths around it that I thought it was very important that we took it up personally. I'm Dr. Jyoti Aneja, your aesthetic dermatologist with over 16 years of experience in dermatology and aesthetics. My heartfelt goal is to support and guide you on your journey to healthier, more radiant skin and hair. Because I truly believe everyone deserves to feel confident and comfortable in their own skin. Some girls are terrified of getting their first period, and on the other hand, we have parents who just don't know how to start this conversation. Some women think unbearable pain is absolutely normal, while others are living with heavy, irregular periods and not seeking help. As a dermatologist, I want to tell you something very interesting. Your skin is definitely something, just by looking at it, we can tell you if there is a hormonal issue underneath. So, your skin, your hair, your hormonal patterns, and your ovulation and menstruation, all of this is interconnected. So, today we're going to talk about what's normal and what's not. Heavy bleeding, irregular periods, blood color, blood clots, skin changes, hair changes, irregular cycles, and red flags that parents often miss when speaking about periods. Let's first understand what exactly is happening. A period is not your body getting rid of dirty blood. That's one of the biggest myths. Every month, your ovaries release hormones, and those hormones prepare the uterus for a possible pregnancy. The inner lining of the uterus becomes thick, soft, and rich in blood vessels, and if pregnancy does not happen, your body no longer needs that lining. So it sheds. And that is your period. The blood you see isn't only blood, it's blood mixed with uterine tissue, mucus, and vaginal secretions. So don't panic if it looks different from the blood coming out of a sharp cut. Before we talk about numbers, I first want to talk to the parents. The biggest mistake we make is not medical, it is emotional. Many parents become anxious about their daughter's first period. They don't speak to her about a sanitary pad, they hide one actually. TV pe ad aa gayi to hum channel change kar dete hain. We don't have these conversations. Please don't wait for your daughter to get her period to speak to her about it. Your daughter should know about periods before she gets one. Speak to her about it, have an honest conversation, show her what a sanitary pad looks like, tell her how to use it. In fact, one very important thing that I would recommend is for every parent to make a puberty pouch for their daughters. What should a puberty pouch actually have? Those sanitary pads, a pair of extra underwear, maybe your shorts, and a clean disposable bag. 90% of the times बच्चे को उस चीज़ की ज़रूरत पड़ेगी ही नहीं. But if at all the child knows that they're carrying it, it just makes them feel very, very secure. Another wonderful option available for growing kids is period underwears, or something that we call period panties. देखने में they look like a regular underwear, but they have these absorbent layers which help save the kid from leaks. So when do periods officially start? Most girls get their first period between the age 9 to 15. So average पकड़ के चले तो say about 12 to 13 years. In my previous video, we spoke about precocious puberty. But having said that, every alarm is not something to scare you. It's not to create panic, but we need to know these numbers. So what is a normal period? Let's simplify this. A normal period is anywhere between 21 to 35 days. Average पकड़ के चले तो 28 days का cycle रहता है. But 28 to 28 days पे ही period आना चाहिए ज़रूरी नहीं है. Consistency more or less is important. और कितने दिन हमारा period last करता है? It could be anything between 2 to 7 days. The fag end of it, the last 2 to 3 days, is usually spotting. So for the first year or two, a little bit of irregularity is expected because your ovaries and your brain, they're still learning to communicate. But having said that, irregularity 2 साल से ज़्यादा तक रहे तो we need to evaluate it. One question I get asked very frequently is, Doctor, how many pads a day is normal? So there is no magic number. Somebody is using a different brand, somebody is using a different quality, कोई overnight absorbent pads use करता है, कोई XL use करता है, because we all understand our flow. But बच्चों के लिए, if we keep it in mind that if at all a child is needing to change every 3 to 6 hours to stay fresh, that is absolutely normal. But if at all you feel you're soaking a pad, you're staining the sheets, or you're staining your clothes, and you're having to rush to change every couple of hours, like a few consecutive hours, then that's something that should raise an alarm. One of the most Googled question by young girls is, what does period blood exactly look like? And the answer is, it changes. Depending upon the day of your period, the flow of your period. So heavier days, the period blood could look bright red. It also tends to turn a little brownish and a little maroonish if you have clots or a heavy discharge. Towards the fag end of the period, the blood could turn a little brown because it gets mixed with cervical mucus. That's also a marking that your period is about to come to an end. Now, if at all you are experiencing that the blood is orange, it is associated with fever, you've got some back pain, there's a lot of foul smell, and you're needing to change very often, that is something that needs medical attention and we should not sleep over it. Talking about periods and we don't discuss clots, nahi ho sakta hai, hame nahi samajh mein aata hai. A little bit of clotting during your periods is absolutely normal. Pea-size, grape-like clots, they're absolutely okay. बहुत ज़्यादा नहीं होने चाहिए, रोज़ नहीं होने चाहिए, but if at all they happen, they're all right. However, if you're passing clots frequently, more than about a 10 rupee coin size, and you're having to change very often, along with heavy bleeding, it definitely calls for an evaluation, because large clots होते क्यों हैं? Blood is not getting enough time to be ejected out of the uterus and it is coming out in clumps. So what exactly are large clots? Large clots usually mean that your bleeding is heavy enough and the blood does not get time to break down before leaving the uterus. Moving on to another myth, pain and periods. अब ऐसा लगता है कि periods है तो pain तो होगा ही. थोड़ा बहुत pain is absolutely okay, but debilitating pain is absolutely not. If at all, एक hot water compress से, एक hot water bottle के साथ, एक painkiller, occasional painkiller when I say that, it's just settling down your pain, that's totally okay. But if at all you have to be missing work, you're missing school, you're vomiting, you're feeling dizzy, you feel मैं काम ही नहीं कर सकती हूँ, that's definitely not normal. A period that keeps you curled up in bed every 1 month is not something we teach our daughters to live with. Pain is a way that our body is asking to be heard, and we better listen to it, because sometimes it could be a sign of fibroids, endometriosis, adenomyosis, pelvic inflammatory disease, so on and so forth. Yes, and that is the reason we get evaluated if at all we feel debilitating pain during your periods. And बात करें heavy periods की, तो it's not just an inconvenient thing to live with. It can definitely lead to clinical anemia. It can lead to iron deficiency, fatigue, and overall lack of productivity. You should see a doctor if at all you're bleeding more than 7 days. You're having to change a pad every few hours, every 1 hour. If you're having to change your pads, you definitely need to see a doctor. If at all you're feeling dizzy, fizzy, or if at all you feel कि energy है ही नहीं, अगर हमें heavy clots pass हो रहे हैं, or if you feel that you're frequently staining your clothes or your bed sheets, you definitely need to get evaluated. Moving on to irregular periods. So if you've just started menstruating, a little bit of irregularity is normal. पहले 1-2 साल लग जाते हैं periods को stabilize होने के लिए. But एक बार periods stabilize हो गए, तो the cycle, usually if it is lesser than 21 days or longer than 35 days, it should raise an alarm. और अगर cycle normally आ रहा है और suddenly 3 महीने के लिए नहीं आ रहा है, we don't need to ignore it and need to get that evaluated at the same time. Sometimes the reason could be stress, other times it could be rapid weight loss or weight gain, because बच्चे बहुत जल्दी fat diets का शिकार हो जाते हैं. There's a lot of junk food involved also. It just could be a plain simple underlying thyroid issue or a PMOS, any other hormonal imbalance, and occasionally it could be something else entirely. But the point here is, do not assume. Speaking of skin, what changes are normally expected on your skin during your periods? Now here's where your skin becomes a clue. If you're noticing painful cystic acne, or your acne is leaving behind scars, your hair has started to thin on your scalp, if at all weight बहुत जल्दी से बढ़ रहा है, हमें dark pigmentation दिखाई दे रही है at the back of our neck, in between the legs, with the groins, in the armpits also, or a lot of facial hair is coming up on your upper lip, on your chin, your jawline, then definitely that calls in for evaluation. Because these are not simple changes happening to your skin, it's actually a sign of hormonal imbalance. Now speaking of 5 red flags that parents should not ignore, so please don't wait if your child does not get her period by the age of 15 years. Or if at all she's been having breast buds or breast development has happened for almost about 3 years and she's still not gotten her periods, you definitely need to get it evaluated. Having said that, अगर बच्चे को हर 1 घंटे में अपना पैड और टैम्पॉन चेंज करना पड़ रहा है, then most definitely she needs help. Please make sure to take your child to a doctor. Now let's conclude by busting a few myths. Period blood is not dirty, and no, most definitely not. Your body is not detoxing by getting a period. Tolerating severe pain and living with heavy bleeding is not a badge of honor. It is not just your normal. And agar painful cystic acne runs in family, it does not have to be your normal too. You need help for that, and there is help available for it. So for every parent watching, Please don't teach your children to fear their periods. Tell them to embrace it properly. Help them understand it better. So, if at all you feel it's the confidence that they're getting with their first period, no, it's with the first conversation that they have with you. So, if you found this video useful, please share it with a parent, a friend, a sibling, or anybody who you think has questions that they are too embarrassed to ask. Like, share, and subscribe to the video, and we'll make sure that we'll keep coming back with more such content.